In this video, we're going to look at choking. Now, this is where a foreign body causes an obstruction in the airway. Some examples of objects that can become lodged in your throat are food, your tongue, or in the case of children, it could be a piece of Lego or a button battery. Now, firstly, let's look at a partial obstruction. This is where air can still pass up or down, the casualty can talk, but there is an object lodged in their throat. The treatment for this is to talk to the casualty and just advise them to keep coughing. This is the body's way of trying to dislodge that obstruction. Keep going, that's good. Is that helping? Good, keep talking to me, that's good. If the blockage does not dislodge after a minute or so of coughing, call 000 for emergency services. Do not slap the patient's back when there is a partial blockage, because this could cause that obstruction to go further down the airway and it ends up then being a complete obstruction. Whilst it is a partial blockage, the patient is at least getting air in and out. Now let's look at what happens when we have a complete obstruction. This is where an object is lodged in the throat and there is no air passing in or out of the airway. It is vital that you treat this as quickly as possible, because with no air going in, the casualty can become unconscious quite quickly. The universal sign for choking is the person grasping their throat, and they are not going to be able to cough or speak. Have you got something in your throat? The first thing you need to do is have someone call 000 emergency services. Now, whilst emergency services are being called, give 5 back blows to the casualty. Stand behind them, lean them forward, and with the heel of your hand, back blows in between the shoulder blades. 1, 2, 3, 4, 5. Wait a second in between each blow to see if the blockage is released. If the blockage does not release, then go to the front and do 5 chest thrusts. This is also done with the heel of your hand, and we're compressing on the lower half of the sternum where we push down to do compressions for CPR. Again, waiting 1 second in between each chest thrust to see if that blockage releases. Continue alternating between back blows and chest thrusts until the blockage clears, or your patient becomes unconscious and you begin CPR, or emergency services arrive.